So I'm Dr. Bob Gill. I'm a general practitioner. I work just outside of London. I've been at this surgery for over 20 years. We have about 5,000 patients here, and I got involved in activism following the closure of a local A&E department, and then this was followed by the threat to another A&E department just down the road. And this really didn't make any sense to me. I had an inkling that the NHS was being changed quite deliberately, but not really the time or the energy to get into looking into more detail. But this threat to the A&E in Lewisham seemed crazy and dangerous. So that's when I got involved. I joined some other doctors and local campaigners and started to learn very quickly that actually what's happened to the NHS goes back a long way, back to the Thatcher government. And the more I learnt, the more I became quite angry about what was happening and wanted to try my best in the first instance to stop the closure of the A&E, which we succeeded in. But along the way, there was more and more that I felt I should be doing to raise public awareness. So that's how I got involved.
A manifesto, in our case, is a fully costed, fully funded set of promises that we can keep and the country can afford. And the £2 billion that's in our manifesto pays for 40,000 more appointments every week, double the number of scanners, mental health support in every primary and secondary school in the country, 8,500 mental health workers to cut the waiting list, community mental health hubs in every community, 700,000 urgent NHS dentistry appointments, and I could go on.
Yeah, so West Streeting and Labour are making some big promises which superficially seem quite attractive. But what they're not discussing is the NHS we have now does not resemble the NHS of 1948. It has been completely repurposed. We have an NHS which is outsourced, privately run. A lot of the leadership come from the corporate sector, the banking industry. And what he's proposing is putting more money into a essentially privatised health system. He talks about 40,000 more appointments. What he doesn't spell out is who are these appointments with. So, for example, if he's talking about general practice appointments, well, the Conservative government have a very dangerous programme of replacing doctors with non-doctors. They call them physicians associates, who've just had 2 years worth of training, never went to medical school, compared to a GP who's had 5 years in medical school and 5 years training on top of that before he's a GP. Now, West Streeting is proposing appointments not with a GP, otherwise he would have spelt this out, and appointments with other healthcare professionals who lack the training and the skills to operate in a safe way. So this is a reckless act, but it's presented as something that we should be happy to welcome. He also talks about other funding going in, but we have an NHS now which is saddled with private finance initiative, and this happened under Labour, under the Blair-Brown years. And this is a very expensive way of building hospitals. As a result of PFI, we've seen a big contraction in the number of beds available for patients. So we have an NHS that has lost more than half its capacity, which has patients struggling to be seen, long waiting lists, and Streeting's promise doesn't address any of those fundamental problems within the NHS, which, unless we fix, any proposals he makes will be driving more money into the pockets of private operators and outsourcing giants.
Double the number of scanners.
The Conservative Party have already started a programme of pulling out scanners and medical equipment out of hospitals and encouraging them to be used in the community setting. They paint this as bringing it closer to home. But what they don't tell you is they're removing essential provision from an NHS hospital and giving it to private providers. And what West Streeting is signalling to these private providers is, I will carry on this agenda. So this is guaranteeing a profit stream to private providers of scanning, and that's inherently dangerous. First of all, it destabilizes the hospital. These scans will be provided by people who have no connection with the patient. Some of the scanning companies will be outsourcing their work to overseas, for example, people to read them in India. So you end up having a fragmented service, a destabilized service, and a service which is now also having to produce a profit for private companies. So that means less money to the patient.
And the £2 billion that's in our manifesto.
So we've had a decade of relative austerity for the NHS. It hasn't kept up with historical funding. As a result, we have the long waiting lists approaching 8 million. We have a workforce that has suffered a squeeze in their wages. They're 20 to 30% less in real terms compared to 2010. Now, West Streeting's not making any promises on that ground. So the 2 billion would just go to cover making up the wages that have been lost to NHS workers. So he's clearly got no intention of sorting out that problem, the industrial action. The money that he is proposing is misdirected and not enough to fix the problem. So it might be fully costed, but it's unambitious and it won't fix the underlying problems that the NHS faces, which is private profiteering and the toxic liability of PFI debt.
I've probably cost the NHS about £2 million to keep me alive. My stem cell transplant in the US would have been 750k.
It's incredible, isn't it?
It would have bankrupted my parents.
Imagine you've been confronted with that sort of bill, and that's
right.
I never ever want people when they fall ill to worry about the bill, and for me that is the best thing about the NHS, and I really mean it when I say over my dead body would we privatise the NHS. I think that's what we've got to work to preserve and to save, and if we don't make the right choices now, if we don't turn the ship around, I really fear about whether it is going to be there for us in the future.
West Streeting's promise to protect the NHS and make sure, over his dead body will it get privatised. Well, I've got news for him. The NHS is privatised. There's been major legislation gone through Parliament 2012 and again in 2022. The most recent act actually has broken up the NHS into 42 public-private partnerships, which are run by corporations for profit. And, West Streeting is either ignorant or lying to the public, because what we have now does not resemble the NHS as it should be, a publicly owned, publicly run service provided by people who are employed by the state. Well, that is not the NHS we have now. We have large number of outsourcing. He's proposing yet more outsourcing. He's been quite blatant about bringing in the private sector to get the waiting list down. So they're not even hiding it. They're so confident that they'll be in government. Well, West Streeting doesn't understand that using outsourcing companies is a form of privatisation. So he's contradicting himself and he's lying to the public just so they can get elected and carry on this privatisation agenda.
I am still alive, I'm not dead yet.
The claims that the Labour Party is caring and compassionate have been blown up by Starmer's leadership. We had a Labour Party in 2019 which was committed to public investment and renationalisation of the utilities, but Starmer's Labour Party does not resemble anything like that. And how they got to the current situation was with a purge of left people in the Labour Party, a purge of the membership, using anti-Semitism weaponised against its own members. They threw Jeremy Corbyn under a bus. Keir Starmer made 10 pledges, which he's abandoned. So, we have the Labour Party, which in my estimation is a totally corrupt entity, which is currently backing a genocide in Gaza. A political party which can turn a blind eye to genocide and excuse Israel's behaviour as self-defence is quite capable of introducing policies that it knows will harm the population in this country. Genocide abroad, democide in the UK. These things are entirely compatible, and I'm afraid that's what the Labour Party is reduced to.
And what is democide?
So democide is where a government undertakes policies that it knows full well would lead to preventable harm and death. And the Conservative Party and its austerity programme did exactly that. So there are international bodies that estimate, 500,000 to 1 million total have been, people have died prematurely as a result of austerity, cuts to social care, cuts to health care, diseases of despair. All of these have contributed to mass harm within this country. It is entirely correct to say that public satisfaction in 2010, when Labour left office, was very high, and it's rock bottom at the moment. And Labour are trading on this, but what they're not telling us is that 13 years of the Blair-Brown government, they carried on the privatisation agenda. They expanded the internal market bureaucracy, which is leeching money out of service provision. They saddled the NHS with private finance initiative debt, which is hugely expensive to service and is taking money away from patient care. And they started the outsourcing of clinical services for the first time in the NHS's history. So although the money was going in, they were setting it up and passing on the baton to the Conservative Party. So they got away with their privatisation because services were looking good. And now they're ready to come in and take over from the Conservative Party, who just completed the next stage of the privatisation, which is to destroy the reputation of the NHS and further hand more and more NHS funding to the private sector. We know West Streeting has received £175,000 from donors with interest in private healthcare. Whatever he says about his public commitment to the NHS, these people who have donated to his campaigning want a return on investment, and they feel quite confident that the Labour Party and West Streeting will deliver more and more privatisation, more and more money to fill their coffers with profit from healthcare. And if we look at Keir Starmer, the leader of the Labour Party, well, he was endorsed by Larry Fink. Larry Fink is the CEO of BlackRock. BlackRock is the biggest private equity firm in the world, controlling $7 trillion of wealth, and a lot of that is invested in healthcare because they want healthcare to expand in terms of delivering them profits. They don't want more care for patients, they want more and more opportunities to extract wealth, and that's what the Labour Party are set to continue. I think most people would agree that if you have politicians supposedly there to serve the public interest, they should not be taking money from large corporations and private donors, because that causes a conflict of interest. I believe these second incomes for politicians should be banned. And I think most of the public would agree, because in the end it's a form of corruption. And that's not what we need in politics. We need politicians to genuinely represent what is in the public interest, and destroying the NHS and privatising public utilities is not in the public interest. How does it make any sense that we pay more and more, for example, for our water bills, and we have private companies raking in profits at the same time pumping in raw sewage into our rivers and waterways across the country? This is what the private sector is interested in, extracting wealth and wrecking the services that they're supposed to be providing. A party genuinely interested in the NHS as we understand it would firstly commit to renationalisation, to restore democratic oversight to the NHS and control, and to remove these outsourcing profiteers and parasites out of the NHS, because they are taking money away from patient care. The next thing they should be dealing with is the toxic liability of PFI debt on hospitals. And in terms of funding, well, pouring more money in at this stage before renationalisation will end up in the pockets of these private companies. So renationalisation first, and then any money coming in has to be directed first and foremost to settling the pay disputes with the staff, because without the staff there is no NHS. So we need to stop the hemorrhage of experience and expertise out of the NHS. And the next thing that should be done is a block on this downskilling, the replacement of qualified, experienced staff with people who lack qualification and lack experience. This is dangerous. We need experienced, highly motivated, well-paid staff to provide high-quality care. And we need regulation that is robust. We need the GMC to protect patients, not provide cover for non-doctor careers, which will endanger patients. And we need a regulator in the CQC which also looks out for public safety and doesn't provide cover for the harm and the preventable death that is occurring at the moment, on which the CQC is largely silent. This building went up in the 1930s. It was built as a surgery with the new housing development. We've had to extend it, but the main advantage I think I have here is we're a relatively small surgery. It's only the equivalent of 2 full-time GPs. We've got about 5,000 patients, and we try and maximise continuity of care, which I think has been largely eroded, unfortunately, with all the reforms that have taken place. What people don't realise is this agenda for doctor substitution isn't to fix a problem. The government have created deliberate bottlenecks to stop doctors from completing their training. For example, for every three applicants to become a GP in the last 3 years of training, there's only one place. Yet the government is now saying, well, in order to get more appointments, we have to employ non-doctors. The agenda, unfortunately, is to stop your access to a doctor on the NHS. And the direction of travel is the only way you're going to see a qualified doctor or an experienced doctor is to pay out of pocket and go privately. And that's the danger we need to wake people up to. We've avoided some of the pitfalls which have been erected for us, such as over-reliance on telephone consultations. We like to do things face-to-face as much as possible. And with that continuity, you develop a relationship with the patient, you get to know the patient, it becomes easier for the patient and for the doctor to know their past history. So yes, a lot more efficient, but unfortunately with the reforms, a lot of that has been done away with, and I believe a large part of that is to destroy that relationship between the doctor and the patient so they can carry on more of their reforms. You know, the move away from face-to-face consultations is dangerous. Part of assessing a patient safely is not only to talk to them, but to examine them. It's only when you're in the room with somebody you can pick up on maybe some of the non-verbal communication, which is very important for assessing patients, particularly with mental health problems or other maybe more sensitive issues at play. So this can't be done over the phone or down a video. The government push to getting more and more telemedicine, unfortunately again, there's a profit element to it because they're going to employ private companies to provide the technology. So very often if you look closely at these proposals, somebody's making a buck. It's not directed in terms of what's best for the patient and the doctor, it's what's best for somebody else. So big tech companies have done very well out of the pandemic and the reaction to the pandemic. There's been a consolidation of power and wealth amongst the billionaire class. Unfortunately, healthcare is not immune from that, and we've seen our NHS become dominated by companies such as United Health, America's biggest insurer. Now own half the patient GP data in this country, in England. They've bought out other companies which have an interest in the NHS. So you've got this consolidation of power. We have another company called Epic, which is a hospital patient data system that's been imported across the country. Now that system was developed to make billing patients very easy, and that is unfortunately what's coming down the road. So when you go to an American hospital, you will receive an itemized bill. Now either that's paid by yourself or your insurance company. Why are we importing that technology into the NHS? For one reason, because that's the system we are copying. I was delighted to see an independent standing in Ilford North against Wes Streeting. I think it would be fantastic if Wes Streeting loses his seat, because that will signal to the political class that we are seeing through their lies. We are fed up of what they've done to public services in this country, and I wish Leanne Mohammed all the success. In fact, I've spoken to her, and I'm hoping to go along and support her campaign.